Sorry for not here. So good morning, all doctors. Once again, welcome you all for this reading session. And today is April 10th. So in 1755, April 10th, our master was born, Dr. Samuel Hahnemann in Germany. And this is his 270th birthday. And this is one of the best auspicious day, which I was looking forward to after the short break of our Thursday class, which I wanted to restart. So it automatically came to be a Thursday. So I consider this as blessings from the heavens, and with deep, deep gratitude and what to say, like our salutations to Dr. Samuel Hahnemann and also to Dr. Prafful Vijaykar, who has made the theories of Samuel Hahnemann so simple through his various books. And we have finished reading his first book, that was the Theory of Suppressions. There we learned about the layers, about the different layers, how to go through the journey of the disease when the patient is coming in front of you, how to look into the suppression layers, and according to the layer wise, according to the hierarchy, how the disease is getting progressed from layer to layer. All these things we are all thorough with. Are we all thorough with that now? Yes. And now the second book is the Theory of Acutes, that we have done with during the time of COVID, when Dr. Atira and Arya organized the online meeting. We were talking about a lot of acute scenarios. So we have done with that thoroughly. Later, when time enables us, we can restart that. Now we are into the third book, that is the end of My Assumptions of Miasm. And we are reading the chapter 6 now. So this is a little bit in detail, where Dr. Prafful Vijaykar is emphasizing upon the three miasms and only the three miasms. There are only three miasms. One is from the defense mechanism of inflammation, and the other one is the second one is from the defense mechanism of construction, and the third one is from the defense mechanism of destruction. So there can only be three miasms, that is SORA, psychosis, and syphilis according to the homeopathic terminology. And Dr. Prafful Vijaykar has been comparing our homeopathic version with the modern science version, like how the same pathology, the same physiology, the physiology when it gets attacked, when it gets opened up towards an injury, when an injury comes to the cell, automatically that goes into the pathology, and what are all the various defenses there. So he had given us full comparison and contrast, and actually there has been no contrast. Everything is in alignment with the modern science and with the homeopathic concept, which Dr. Samuel Hahnemann has given 200 years back. So now, where we had stopped in chapter number 5 was the various stimulants which can injure a cell, like the physical agents where there can be mechanical trauma or sudden atmospheric changes, etc. So I'm reading from page number 64. And hypoxia can lead to a cell injury. Ischemia, that is the decreased blood supply, can lead to a cell injury. And then certain chemical agents, like lesser amount of glucose or more amount of glucose, lesser amount of salt or high amount of salt, lesser amount of oxygen or high amount of oxygen, all these things can cause injury to the cell. And infectious agents like bacteria, fungi, parasites, viruses can all cause cell injury. Immunologic reactions also can happen, like self-antigens can also cause cell death. And genetic derangements can cause, and nutritional imbalance, and benumbing agents like anesthesias and foreign proteins like vaccines can all injure a cell. Now, are we pakka to go to the next chapter? That is chapter 6. Give me some indications. Are you all with me? Are we ready to go to the next lesson? Chapter 6. Yes, doctors? Yes. Yeah. Yes. Yes. Thank you, Sai Narendra, Shupangi. Yeah. So let us go to and Dr. Kyle Vidi. Yes. Let us go to the chapter number 6. That is page number 67. Cell defenses at work. Yeah. So what are all the changes happening at the cellular level are the changes happening to the body as a whole? So what are the defenses at the cell? Man is made up of cells, 70 trillion cells. So the changes happening in an individual cell can be generalized. Yes. When any of the above factors threaten to injure or really injure a cell, the cell starts defending with whatever resources of defense it possesses. The primary mode of defense, as we already saw, is adaptability. We all will adapt. When rain happens, what will we do? Either we will not go out, or we will close the door, or we will adapt inside, or we will use an umbrella and go. Lot of adaptations are there according to the gradation of the living organism. In adaptability, the cell or tissue tries to strengthen or increase the normal tissue or cell mass to give rise to hypertrophy as a response to increased stress. Vice versa, it sheds off the mass to give rise to atrophy if the part is less used. There is some noise. Give me some time. Hypertrophy or atrophy. Such normal adaptation response is observed only in natural stress-oriented or exercise-oriented factors in which the muscle or tissues try and re-establish the கதவு சாத்திக்கோங்கடா இந்த கதவு சாத்திக்கோங்க stress-oriented or exercise-oriented factors in which the muscle or tissues try and re-establish a homeostatic equilibrium in changed circumstances by bringing about changes in themselves. What is the best example? When the BP increases, heart will have to contract a lot, and then the heart muscles will undergo adaptation, and that is nothing but the hypertrophy. And when we do a lot of muscular exercises, or the labor class people, they are carrying a lot of weights every day, and their muscles will adapt. Only then they will be able to carry more and more weight. So this hypertrophy of the muscle is nothing but the defense mechanism, or nothing but the adaptation. We were talking about the adaptation. Yes. So only then the homeostatic equilibrium will be maintained there. No aggressive option is available here to remove the stress stimuli. With this adaptation, we can go on and on and on, and there will be no breakdown. This is only an adaptation. This is only an adjustment. When the stimulus is more irritating, more destructive, or more injurious, like bacterial, fungal, or viral infections, or constant trauma, physical or chemical, the cell takes a different stand. So when this adaptation is not sufficient, the injurious agent is much more stronger than whatever adaptations we are possibly able to do, then our body goes into the next stage. What do Vijaykar sir say about this? We will change the gear, or we will shift the gear to a higher one. The defenses which follow are as follows. What are they? What are the defenses? Okay, let us not go into the color chart now. We will go into page number 68, the next page. Cell defense mechanism. Every cell or living organism faces damage or cell injury from pathogens, toxins, chemicals, radiations, thermal factors, etc. It has different types of mechanisms to defend. What are they? One is physiological defense and the other one is morphological defense. Morphological means structural. This type of defense involves change in the structure or morphology. We are all thorough with that. This morphological defense expresses itself in two different manners. One is by construction and the other is by destruction. So, for all practical purposes, there are only three available means for a cell to defend. The first one is the three defenses. The first one is the physiological defense, or that is the SORA in our terms. The second one is morphological or constructive defense, where there is a structural changes seen. Structural changes are observed there. That is constructive defense psychosis. And the other one is morphological destructive defense. Again, structural changes are there. That is destruction, syphilis. Now, a little more detail. The first defense, that is the physiological defense. Physis means nature. Physiological means physiology, or promoting normal or healthy conditioning, healthy functioning. It means a defense by a cell or an organism brought about by promoting the natural or normal healthy functioning in the cell or tissue. So here there will be no altered structure of the cell. Whatever is available within the cell will be made use of. So no external things are brought in, or no structural changes are happening. After the process is over, nobody will be able to understand that anything had happened here, but for structural. If it is a structural thing, even after the injury is gone, or even after the reactions are gone, there will be a deficit there. And with the look of the structure, you will be able to know that the structure is changed. So something had happened. In the SORA, in the inflammation, after the inflammation is gone, it will be back to normal, completely normal, because it is physiological. Say a cell is attacked by a bacteria or a fungus. The first step the cell may take is to promote production of certain already present antibacterial agents secreted by it on the cell wall, like lysozyme in mucous membranes, or some unsaturated fatty acids on the skin epithelium. So this is the normal physiological function, lysozyme or any fatty acid, unsaturated fatty acids. But then we all know about the functioning of lysozyme. Yes, in order to destroy the microbes. It may induce a cell to produce free fluid in large quantity so that the bacteria or fungus can be washed off. Yes, we all know that. The best example is a cough or cold, or a lot of discharge from the nose. This is commonly observed in cases of upper respiratory tract invasion by any organism, where first defense is the production of fluent coryza. We all know that. If this fails, what happens? The primary immune response of inflammation is used to get rid of the invasive stimuli. It is preceded by increased sensitivity and irritation. This is what is happening in allergic rhinitis. Lot of increased sensitivity and irritation will be there. There will be formication of the nose, formication of the eyes, formication of the palate, formication of the throat as such, and there will be a lot of discharge also coming up. No, lacrimation will be there, and fluent coryza will be there, and there can be a lot of postnasal drip, and there will be pharyngitis as well. All these are the primary things, primary inflammation. Sensitivity and irritation, all these are part of which miasm? SORA, soric miasm. When the bacteria or the harmful agent does invade the cell, there are changes which are brought about in the interior and exterior of the cell, which are purely chemical, like increasing or decreasing the pH of the cytoplasm, or as mentioned earlier, excess production of antibacterials. So these chemical changes are only in the level of the biochemistry. So nothing is happening there. Only some changes are happening. Some changes in the blood values are happening, which will be brought back to normal. The immunoglobulin E may be on the higher side. Yes. And maybe sometimes we see a lot of cases of chronic allergic rhinitis, which is sometimes very difficult to cure also. How many of you have seen such difficult cures, difficult to treat allergic rhinitis? Which layer is that? Allergic rhinitis is only our endoderm, right? Ectoderm or endoderm. The nose and the other thing all belong to the ectoderm, where the mucous membrane is covered. It belongs to the ectoderm. And this ectoderm, that is the layer 1, that is the first miasm, that is the soric miasm. We are not able to treat that. What does this mean? Yeah. Have you all had this type of difficult cases? Difficult cases in the allergic rhinitis? Did you have? Or is it all very easy for you to cure with one dose? You have all been curing? Yes, Ananti is saying yes. Yeah, somebody is saying it is difficult to cure allergic rhinitis. Yeah, sometimes with one single dose, it is all getting cured. So what do we have to probe here? Let us have a little bit of discussion. Let me give you my experience. So there was a person who came here. He was having chronic allergic rhinitis, which means it is not only SORA, right? There is immunoglobulin E levels are more than 1000. What is the normal level of immunoglobulin E? Should be somewhere around maximum 300, right? It should not go beyond that. So we get that in thousands and in 2000s. So this person, yeah, it should be less than 50, Dr. Sai Narendra is saying. Yeah. So here, this lady, her name was Ambiga, and she was a higher official in one of the reputed firms. And she came to me like both the nostrils are completely blocked. In how many days? In one day. Till yesterday, she was all fine. So what is this? Is it acute or chronic? This is acute, right? Then I asked, what is to be asked? Ailments from. Yes, Adira. We want to ask for ailments from, no? I asked her, okay, what had happened? Then she said, I did my blood work because I am not able to sleep at all. Both my nostrils are completely blocked. I checked, everything is completely blocked, and she is having the nasal tone, and she is kind of breathless, not because of the lower respiratory infection, but her nostrils are completely blocked and gone. So she is breathing to the mouth. So that is why she is kind of breathless. And when I saw the immunoglobulin levels, it was more than 1,000. It was 1,500 and above. But her eosinophil levels are normal. What does this mean? Her neutrophil levels are normal. Lymphocytes are normal. Eosinophil levels are less than 5. And her immunoglobulin E level is more than 1,000. What does this mean? And her total count is normal. That shows that this is acute. Even before, maybe her CRP would have been high. That I did not order. She also did not do. Okay, the CRP will be high in the acute thing. So here what had happened is, even before the changes are happening in the cellular level, the immunoglobulins are so very sensitive. Immunoglobulin means what? Hypersensitivity. Immunoglobulin E means what? Hypersensitive reaction. So even before the neutrophils are changed, or the total count is changed, or the eosinophils are changed, there are changes happening in the immunoglobulin levels. So here she had straight away done that. And she had come to me. I asked her about the ailments from what had happened yesterday. She said, nothing happened, nothing happened. Then I said, no, this is on the nose. You don't have nose only now. You're not able to breathe. What is detrimental? You are sad with something, or you're humiliated with something. She said, yes, I am humiliated. In the office, there was a program happening, and I was the organizing chairperson there. So I wanted the stage to be in a particular fashion, in a particular idea. And I asked the peon to put the chairs in this order. That was a guy. He disrespected. He did not even give heed to what I'm saying. And he was shouting at his subordinates to put it in his idea. What about my idea then? And I am the program coordinator. I got terribly upset. I felt so bad. I felt so humiliated. I am honor wounded. Yes, Dr. Sai Narendra. And this is a prestige issue for me. I am a lady and I need to be respected, of course. The normal respect, not the platina respect and all that. Of course, platina can also be here, no? Because the nose is affected. And the other thing is, maybe the peon would not have done any real honor, what to say,
Real
respect.
inspection.
Yes, the peon might not have done any real disrespect.
That
It
was
was
her
perception.
that was her false perception.
False perception. Yes, thank you, Sai Narendra. It was her perception that this guy did not listen to me. And I took honor wounded ailments from humiliation and all, and I had given her Aurum Met. And what she did the test after 24 hours, and the next day again at the same time, she is coming here. Doctor, I'm all good. I asked, what about your rhinitis? What about the discharge? No discharge. What about the nose block? No nose block. And you slept well yesterday? I slept like a baby. And what about your hurt? There is no hurt. Even Dr. Atira was having a similar situation with her daughter. Some injury was there for her leg. So with one dose of the hurt, because the child wanted to dance the next day, and with a leg hurt and with a hairline fracture on one of her toes, the child was not able to put her leg down. She was on with a crepe bandage, and Dr. Atira wisely resisted the POP because the child wanted to dance on stage the next day. The child was ready to dance. The child was ready to dance, but then she is in terrible pain because of the hairline fracture. So there was no time left to us. As usual, we have started her on arnica, but then the hurt was not gone. So we just probed into the hurt, and then we got some remedy, and we gave her one dose of a remedy to take her hurt off. That hypersensitivity or the normal sensitivity, whatever it is, or that sensitivity should be gone. Then whether it is hairline fracture or whatever, the child danced beautifully on the stage. Isn't it, Dr. Atira? Yes.
Yes, ma'am.
Yes. So here also, whether the fracture is there or not, or whether the immunoglobulin E levels have come down or not, the hurt should go away. For that, I had given her Oramet 200 single dose to this lady known as, her name is Ambika. And in one day, in 24 hours time, or even less, the 200 single potency, Dr. Kyle, 200 single dose, 200 potency. And there is no nose block at all. So how much time do we need to effect a cure? Yeah, in psoriatic cases and all, of course, within 1 hour, within 2 hours, because it is the question of how much time do you need to remove the sensitivity. When the sensitivity is gone, there is no disease. The defense mechanism is only directly proportional to the sensitivity. So this is the reason why Dr. Prafful Vijaykar always says that after the phenotype, the action of the phenotype is fully over in the sixth layer and seventh layer diseases, the patient will come back again with certain sensitivities. So then when you are taking the GCS, you don't know what to take in the GCS then. And you are coming up with a remedy, you are picking a few rubrics and you don't know whether this is the right remedy or not. Just see to it that this remedy touches the sensitivity of the patient. You have to give importance to the SORA, because in the sixth layer and in the seventh layer, there is no SORA. And whatever picture is given to you are not given by the SORA. That is given by the distractions. You have taken all those delusions or the deliriums and you have picked up the pathology of the disease. You have combined the rubrics and you have given them a medicine that has brought about 99% cure. And now for the 100th percentage, the patient will come back to you saying that I am not well. What does that mean? The patient is having the SORA there. That is the reason why the patient is now saying I am not well. All these days, the patient will be saying I am better, showing the video, I am walking nicely. Why? The SORA has not come there. So the patient will want to impress the doctor. cure. Now remembering one more case. Are you ready to have one more case now before we go into the next paragraph?
Yes, ma'am.
Yes. So this is also a case of allergic rhinitis. Because why I'm talking to you about allergic rhinitis is, of late, I have not been getting any single cure for this allergic rhinitis cases. All the cases are coming back again and again. Why, ma'am, you are not able to treat this allergic rhinitis? So now I am remembering about my good olden days where I had created a good cure. One case. Now you have to tell me the remedy. So here I'm remembering this patient, a guy coming to me with clad in white and white, okay? White full sleeves and white full bell-bottom pants. And this guy was rather testing my questioning ability, or in homeopathy, we have got a very good questionnaire. And like we are very friendly with the patient because we want to know the innate sensitivities of the patient. If we are like allopathic doctors, we will never get all those things. So we are keen observers. I am looking into all his movements. He is understanding all those things. Okay, this lady is questioning me. This lady is looking into me so nicely. And he was rather amused. And he was rather, okay, come on. What is your next question? So she is so much interested in me. This was the kind of attitude he was having. And I was rather uncomfortable with that. So I asked about his job, and then he said that he quit the job. Then I asked about, I understood that that was his sensitivity. Then he initially wanted to tell me some lie. Yeah, because facade, no, Soro psychotic. So he wanted to tell that a lie, but then somehow, maybe because of my sincerity or something, he did not want to put me down. So he said that, now I am not into a job. I'm trying for a job. Then I caught hold of that. Okay, why did you not have job? What job were you doing? He said, I was a professor there at some college. Then I said, what happened to that job now? I quit the job. So what was the reason for quitting the job? He would not say. He would sit simply. I did not leave him. I told him that this is your sensitivity and this is the reason for this. He said how he started arguing. I ignored all those things and I insisted upon this point, and he had to disclose that with tears in his eyes. So he said that there was some argument with some children, with some students, no, high-fi students or something. And as a professor, what I did was right. And the other people were all standing against me, and the management wanted me to say sorry. So I thought that I will not say sorry. So I quit the job. So this was the scenario. So I understood that this person is of very high esteem, very high esteem. And he is not a metallic person from the attitude, from the this thing and all. He is not a metallic person at all. He, as such, he has not given me any respect. I have seen lot of metallic persons in the most destructive phases who have given me, I was very young at that time, and these people were very pretty matured, pretty old. They have all considered me as their own daughters, or they have given me lot of respect. So that is a real metal. So I understood that this person is not a metal, but then he is an esteemed person. So it can be something like lachesis or veratrum. So this guy was having lot of discharge, profuse discharge. Profuse discharge means what? Rice watery, profuse discharge, watery discharge. 2 to 3 kerchiefs will get wet. And this guy is like this, no? I cannot say sorry to anybody. So I thought that I'll rather quit the job. Now he is jobless. And look at his attire. So that is also to kind of impress. So I asked about his desires for branded, and he said yes to that. And I asked about his desires for aerated drinks, carbonated drinks. He said yes to that. And what is the remedy? Veratrum album. And yes, ailments from position loss, esteem affected, veratrum. Yes, 100 marks to all of you. I had given him 1M or 200, I don't remember. But then according to the intensity, I would have given. But then the other lady, I remember I had given her only 200 potency. Even it was 1M potency also, it would have acted very well there. Here I had, I don't know what remedy, what the potency I had given, but veratrum 1M or 200, both of them are ideal. And he thought that it will not get cured because he was with that for 2 to 3 years. He was going from doctor to doctor. And with somebody's recommendation only, he had come to me. And with that one dose, I have not seen him again. I saw him on the road. He is a neighbor of mine. So he said that I'm all good doctor now. And I got a baby also now. So because he was having something like azoospermia and his wife was also not getting conceived. That problem also solved with the veratrum. So this is our deep acting remedy, rapid, gentle, and permanent. So there has been no reason for any allergic rhinitis after this veratrum or after the aurum. So this is how the defense mechanism of the body work. So the primary immune response is inflammation, where there will be a lot of discharge from the eyes, from the nose, etc., to flush away the bacteria or to flush away whatever dust or pollution or whatever it is. But we know that it is not the bacteria, it is not the dust or pollution or the pollen which is causing the allergic rhinitis, but it is the sensitivity of the patient. So what is the meaning of this bacteria then? If it is only sensitivity, then why in certain cases, in certain fever cases, we get the bacteria on the rise? So before the bacteria has come and attacked us, there was a sensitivity for us, and that is what we search for in our ailments from. Yes, susceptibility, sensitivity. What was the thing? What was that particular sensitivity which made you attract the viruses, which made you attract the bacteria, or which made you sensitive to the dust, which made you sensitive to the pollen or to the food or to the prawns or whatever that you have eaten. Until yesterday, you have eaten prawns and nothing had happened to you. But today, when you took prawns or when you took katirika or this brinjal, your skin is reacting. Why? What is the sensitivity there? So it is not the brinjal or not the prawns or not the peanut allergy or not the pollen allergy that is causing you. You are only hypersensitive to some stimulus. What is that? So that is our question as homeopaths. And how many doses do you need? One dose is more than enough to cure the entire personality. So when the bacteria or the harmful agent does invade the cell, which means there has been some prior changes in the cell due to the sensitivity of the person, and that is why the vulnerability of the cell has happened, and now the cell is opening to the bacteria or opening to the harmful agent. So when the bacteria or the harmful agent does invade the cell, there are changes which are brought about in the interior and exterior of the cell, which are purely chemical, like increasing or decreasing the pH of the cytoplasm, or as mentioned earlier, excess production of antibacterials. The sole aim is to make the bacteria die its own death by changing temporarily the biochemistry within the cell or the neighboring tissue. This is the first defense, the physiology defense. So this first defense is nothing but the inflammation, where little bit of heat will be increased so that the bacteria dies or the viruses or the microbes dies, or there can be a lot of discharge where it will be flushed off. So this is the first defense. And after this defense is over, everything will be back to normal. Inflammation is the physiological defense response. That is tonsillitis, bronchitis, gastritis, gastroenteritis, appendicitis, arthritis, pneumonitis, hepatitis, meningitis, or encephalitis are names of diseases every physician is acquainted with. A knowledgeable physician is aware of the fact that all this suffix itis indicates inflammation of the said parts. Books of pathology categorically state that inflammation is a protective response. Who says this? Not Hahnemann. In the book of pathology, it is written that inflammation is a protective response. The ultimate goal is to rid the organism of both the initial cause of cell injury like microbes, toxins, etc., and consequences of such injury, example, necrotic cells and tissues. So, we don't want any microbes in our body and we don't want any necrotic cells or tissues in our body. So in order to do that, inflammation is the best defense mechanism. If there is inflammation, the microbes or whatever will be got ridden off from our body. And after that response is over, nothing will be seen, nothing abnormal will be seen in our body. There will be no necrotic cells or tissues. Our cell will be as pure as possible. Now, the next paragraph is, inflammatory response is closely intermingled with the process of repair. Yes, that is why inflammation is the best defense possible. After inflammation, automatically there will be a repair, 100% repair happens. Inflammation serves to destroy, dilute, or wall off injurious agents and in turn set up series of events which heal and reconstitute the damaged tissues. So that's why there is no necrosis, there is no scar. Yes, in homeopathic medicines, when you give a medicine for burns, etc., the scar will not be there, or even or very, very minimal. Or for small injuries and all, there will be no scars with homeopathic medicine. Why? Because it produces the proper inflammatory response. Along with that, it will produce what? A cascade of protective mechanisms in order to reconstitute the damaged tissue. So without inflammation, infections would go unchecked. Here I remember again about one of my famous cases, which had given me a lot of confidence. After meeting Vijaykar sir, this had happened, where I have narrated this case again and again many times because this was a real eye-opener, and where the destructive ulcer, a callus ulcer, came back from the syphilitic miasm to the psychosis, and from the psychosis to the psoric. So in the syphilitic, it was all a dead tissue. It was a non-healing ulcer. It was on the heel of the person. He was highly diabetic. He was IDDM patient, okay, and he developed this callus ulcer, non-healing wound. After giving Oromet single dose, what had happened? He was working long back in Ashok Leyland. Okay, leave all those case history behind. After giving Oromet 200 single dose, he was coming all the way from Erode. There had the change from syphilis to psychosis happened. The flesh started coming up and yellow pus started oozing up. So I understood that, okay, this is a change from syphilis to psychosis, nothing to worry. And then what happened? I gave him SL again after 2 weeks. In no time, this has happened in 1 month's time. Complete healing has happened. In 2 weeks' time, the psychosis process started, and in the last 2 weeks, the inflammatory process has started, wherein all the wound is completely closed. Normal flesh has come up, which means the blood vessels and the nerve cells, everything has come up there to help the healing. 100% healing had happened. And after the inflammation is also subsided, there is no scar. There is no scar. Nobody could understand that there was such a deep injury where we could see syphilitic ulcer. So this is how, if you are able to produce an inflammation, it is well and good. Then you know that you are on the right track. The inflammation, along with the inflammation, there will be pain. He was complaining of pain then, whereas he did not have any pain in the syphilitic phase. Why? There was no healing. Why? Because there was blood vessel destruction. Needed for come up for the what is needed, nutrition needed, and life to paralysis to nerve that portion of his body was dead. Necrosis there. So after the right.
Hi, ma'am. Hello. Ma'am, net issue now. Okay.
Can you all see me?
Yes. Yes.
Sorry for the improper net fluctuation in the net connection. Somebody was asking me some question. Did anybody ask any question? No, na?
No, ma'am. Actually, we want to say the net is not.
Yes. Okay, sorry. So we were talking about the Oramet case where the life came back to him. Life came back to him at that portion in the form of a nerve fiber, in the form of blood vessels, in the form of oxygen nutrition, and proud flesh came up. And after that, the inflammation had set in. Then you know, of course, this is going for a complete cure without even any scar. So wherever there is inflammation, you can be happy. Okay, if inflammation is produced, you can be happy and you can assure the patient that this is going to be a complete cure, even better than a robotic surgery, the most accurate surgery, even better than that. We have done that even without touching the place. Yeah. So inflammatory response is closely intermingled with the process of repair. So I think now should we wind up here? It is already 10 past. So today being Samuel Hahnemann's day, I think lot of programs are going on, lot of online programs are going on. Even Dr. Ambarish sir's meetings are all there. So do we want any quick discussion? Do we, maybe I shall wind up the reading now here. So any discussions or any quick questions are there so that we shall wind up early today, 5 minutes early. Anything is there? All happy?
I have a case of Parkinsonism. So,
Okay.
it was a long case, whether we don't have time. That's right.
It is getting better. It is.
No, I am just taken the case.
Discuss, right?
Yeah. So he is a 72 years age person. He has had 2 daughters, and both of them are married and well settled. And he's a pastor, and now he is retired from the pastor work also, but still he is doing some services and all. And well, actually, her in 20 years of age, he had an accident. Brain injury happened, and he completely paralyzed. I think voice is lost, and some right hand, left brain only affected. So right hand is some problem, and walking also a bit difficult. So he is very positive that this is what I feel, and he motivated himself to walk, and he gain all the voice and all the movements, everything he's done, and he joined the job, and he done many type of job, and finally he got a good job, and he paid very well. But after some times, in the beginning of his life only, at the 35 or 40 or that time, he resigned from the job, and he converted, means he want to become a pastor. Yeah. So, and he wanted to do some services. But at that time, her wife is pregnant, and she was very much frustrated about his decision, and there was no financial that was also. And the wife is very much capable, and she started a business. And as she is pregnant, she couldn't handle that properly. So she told him to take care of that business also. So, but what he has done means he invited his friends, one of his friends and cousin brother or some to take care of this business. And he partner he added them as a partner, and the partners deceived, somewhat manipulated, and take away the business. And
Yes.
and the wife got very much frustrated, and she is always means what
Angry.
yeah, I know, means humiliating, insulting her because his mistake only done everything. But he is actually a person who is very much benevolent. But whatever he is asked, when others are asking something, he will give in his hand without thinking about his family or something. So he is very much zero about the financial things about the his family. But when somebody is asking some help, he will give.
Society, he is ready to do.
For society, he is doing very. So for
Okay.
society person, he is a very what to say, very.
So this itself is abnormal, right?
Yeah.
This itself is abnormal. He has to be first primarily, selfless. Yes, Shubhangi. If he is selfless, then he should be equally taking care of his wife also.
Yeah.
So he is not really selfless. He is partially. He like in the 50%, he wants to help the people outside the society, but not his family. So that itself is wrong. Primarily for a person.
Yeah, but he is very much affectionate person, but he is not able to. That's, I don't know.
Okay. Maybe it is the delusion of the wife also, no? Sometimes. That he is, Maybe when you ask with this patient, then we will know his ideas. So anyway, he is a generous person. He wants to help others. Yes.
And he is suppressing so much when her wife is telling like this. So, and one COVID time, both of the children is not there. So she called them, and first time daughter told me that first time only he is opening up, and he failed all the.
What we do now is Atira, you present this case later on. We shall do a proper workout of this, because the Parkinson's case is much deep acting remedy is to be needed. So much depth of study should be made in the case taking. So we will discuss about this case in our next class. Now, next class or any other class in the following classes, we shall discuss this case and pakka, and then we will find out the remedy here.
Okay.
You can discuss it with me also, or you can send that whatever case taking is there through the group or whatever. We shall discuss it there. Otherwise, we are not going to finish it now. So it's all 58 AM. People will want to log into other things also.
Okay, ma'am.
Bye, dear. That is okay with everyone now. Yeah. Bye then.
Thank you, ma'am.
Let us now. Thank you.
50 millisiemen. Very rarely, only in skin cases. I shall discuss about that in the next class, KLBD. Okay. Bye, guys. Bye, dears.
Bye.